You and the Director of Health and Welfare have kind of talked about the lack of testing a lot. And that's also one of the ways you'll decide to move to each stage. And without adequate testing, how do you know if we've met those benchmarks, like seeing the downward trend of tests within 2 weeks?
Well, there are multiple benchmarks if you go to the website. And of course, one of the big ones is hospital capacity. That's the ultimate goal, is to maintain, well, the ultimate goal is to have everybody be safe, but the most critical thing is hospital capacity. So it's testing, it's because testing is here, but if we have a big run, particularly in the respiratory area and in hospital capacity, then we know we've got a problem. And that's everything we've done from the beginning, is to preserve that hospital capacity. Testing is part of that, tracing is part of that, but the best tool is behavior, great behavior, social distancing, masks. Critical is, if you don't feel good, stay home. And if you exhibit any kind of signs, then go get tested.
So speaking of medical capacity, about 2 weeks ago, you said that you had about 2 weeks supplies of those medical supplies. So where are we with those PPE and other medical supplies?
Well, we've got a big inventory that the Idaho Office of Emergency Management manages, and of course they manage not only their inventory, they know what the mayor has, what the hospital has, because we're in this communication. Because if the police or fire department have a problem, we're the backup. So we're kind of okay on masks, not these masks, but the good masks, the N95 masks. Gowns, we can use a little help there, and we're procuring and working on that. But I was mentioning earlier that there's some new testing. There's testing that's not as deep a nasal, and we're hopeful that there might even be a saliva test. That would really help, because the people that are doing the testing have to be fully, shields and masks and gowns. And that would really help if we had some other kind of testing. So as things progress, there's different things that are more critical. The president today is going to be in Arizona. Honeywell's putting in a great big new N95 facility. There's some other ones coming on. I think that we'll have adequate masks. But one of the things my economic committee recommended, that we heard from the business community, is businesses that want to open up, that have a lot of exposure to either other employees or to the public, they need masks and all kinds of protection. So we're going to take the state's buying power, buy and then distribute to those businesses. So that's one of the things we're doing in the PPE area.
And antibody tests have started to pop up in our area. Bainham Healthcare is doing them, Crush the Curb is doing them in Idaho Falls and Pocatello. How is the government, the state government, going to use that data, and if at all, and will that contribute to decisions about reopening?
Yes and yes, but they're still, they just actually certified one antibody test, and there's some mixed, but it's still data. It's good data, and we take it and aggregate it into our data. I just got an email from the spouse of one of the people that's worked for me for a long time, and their daughter had a positive test. But we have false PCR tests, we have false antibody tests, but the big deal about antibodies, we don't know how good they're for. My chief epidemiologist says 6 days, 6 weeks, 6 months, or 6 years. And it would be a tragedy, and all these viruses are different, if people thought an antibody was going to help them and it only lasted 6 weeks and then they could get re-exposed. So there's still a lot of science, and it's being developed every day. So.
And moving to some of the economic problems and how they're affecting Idahoans, 117,000 have applied for unemployment benefits here in Idaho. Today, rent is due for a lot of Idahoans. They can now be evicted because the Supreme Court had said for the rest of April that eviction courts were closed because of social distancing. Now people can be evicted. Have you thought about a moratorium on evictions? Is there anything that you're going to do to address that problem?
Well, there's several things we're doing. One of the problems, if you just say, it's like a lot of things in government, you say, well, this will fix it. Well, if you're an individual and all your income's coming from rental, and you say, you can't get that rental income, then what do I do with that person on that end of it? The big commercial landlords are going to get some help from the federal government. So I've got to digest all this at the right thing. And then I try and convince landlords, work with your tenants, because this economy's not great. And you may evict them, and you may not have anybody there, and having them pay a quarter or half and let it accrue is a heck of a lot better than having an empty building. So there's a lot of things we're doing. Our new program, our $300 million program, is going to go out to businesses. Some of those people that are small entrepreneurs, that money should help them pay their rent. There's these other programs that are going to come in and help pay rent, but I don't know of one thing we can do to fix it. I know of a lot of things that we're doing and we can do to help.
And Mayor Blatt actually touched on this a little bit, but you've gotten some pushback within your own party about your stay-at-home order, even from your lieutenant governor. How have you kind of balanced the politics of all of this with having to make public health decisions?
Well, when I visit with my fellow governors, one of the things is, this is a point in time when we got to do things, and every week I talk to all the mayors, I talk to all the county commissioners, I talk to all the legislators, and I communicate, I listen. My staff, we get a zillion calls, we take a lot of input, but every day I come to a fork in the road where I got to make decisions, and I don't have a lot of time. We try and do it with the best available data, but I think the fact that we were the last state to get a case and we're one of the first states to open up is reflective of what we've done collectively, and a lot of that is just the good behavior of the people of Idaho, that they've social distanced, they've stayed home, they've done a lot of other things. So I fully understand criticism, but people that are advocating for people not doing what everybody else is doing is unfair to the people that have made the sacrifice and are doing the right thing.
And sorry to jump around, back to testing. You made the testing task force a week ago. I know it's just a week, but what have they done so far, and what are you expecting them to do?
Well, quite a bit. One of the things we're trying to do is, as all this data comes in from the different tests, and there are different tests. There's the PCR test, there's the antibody test, there's the not as invasive PCR test, and now we're talking about a saliva test. We have to do that and aggregate that into the data that makes a determination of what we do, what we do going forward. One of the things we talked about yesterday, I talked with my team, is if you're a county that was identified as having community spread, what do we do to get you off of that list? What happens in tracing and testing to where when somebody shows up at Portneuf and tests positive, or one of the clinics and tests positive, if we can say, we know that person was next to this person and this person, we've identified him, then it's not community spread, and then those counties will go off of the list, which is important for us to give those communities more certainty. But a lot of it's aggregating the data, a lot of it's what testing is working. A lot of it is where do we put resources into testing, where do we put money into it. We just got a significant boost in PPE and testing reagents and swabs from the federal government. I think what's really critical in Idaho is that we deploy that out to the rural areas, to Bear Lake and to Clark County and to Fremont County, those areas that are isolated, to make sure we don't have community spread there.